All right, guys, I want to get started with our safety and sanitation PowerPoint lecture. So I want to show you where it is first. So we are in the Animal Science and Technology course, and we go to Unit 1, which is Safety, Care, Management, and Behavior. From there, you want to click on Module 1 because we are still in Module 1. That's was August 11th through the 21st. So we click there, and you will scroll down to this updated safety and sanitation PowerPoint, and that is the one that we'll be using today for your lecture. So here it is. All right, so I first wanted to start talking about OSHA. OSHA stands for Occupational Health and Safety Administration. I use OSHA a lot. We talk about OSHA. You guys will be doing the OSHA 10 Ag certification for this course. So it was developed in 1970 and was created. OSHA is the government agency housed by the U.S. Department of Labor, which regulates and monitors employee safety in the workplace. And this is the workplace. So your school is the workplace. When you're out working, wherever you may work, in a fast food place or whatever, or a vet hospital, that is also the workplace. And they should also abide by OSHA regulations. So you can use what you learn in class out in the workplace as well. So OSHA is there to protect employees from injury. They develop guidelines for handling chemicals and just being safe around the business. And we try very hard to make sure that if water gets spilled, it gets cleaned up quickly. We have SDS sheets, or it used to be called MSDS, Material Safety Data Sheets, but it's now called SDS, which you will learn about. So with all the chemicals that we have those sheets in case somebody would accidentally get it into their eye or something like that. So OSHA is there to help protect us, the American workers. So SDS, Safety Data Sheets, and you will need to know that. It's formally called MSDS, Material Safety Data Sheets, but they kind of dropped the material part. So I sometimes refer to it as MSDS. So please understand that SDS and MSDS is the same thing. So when I'm talking, sometimes I still refer to it as MSDS. So SDS safety data sheets. And in those safety data sheets, there are about 8 sections. So manufacturer information, who made it, what their address is, what their phone number is, any hazardous ingredients or identity information about what the chemical is, physical and chemical characteristics. So is it a liquid? Is it a solid? Is it a granule? That type of stuff. Fire and explosion hazard data. So is it highly explosive? Is it not? And what you need to do if that chemical catches on fire. Reactivity data. So I usually give the example of like bacon grease and water. So say you're making bacon on a Saturday, Sunday morning, and then you take the pan and you put some water in it right away. That is the reaction there, the spurting, that is reactivity data. So that's kind of my example. Health hazard data. So what health problems this can cause? Can it cause skin irritation, irritation? Can it, if you use it in an enclosed area and you're only supposed to use it outside, can it cause respiratory problems, stuff like that? Precautions for safe handling and use. This is where your PPE comes in. PPE stands for personal protective equipment, and that is what you need to wear when you're handling this chemical. So it could be goggles, gloves, a mask, an apron. Those are examples of PPE, personal protective equipment. A mask that we wear every day to school now is PPE, personal protective equipment. And then we have control measures. All right, physical hazards that you'll see in the veterinary field is animal injuries. So that can be bites, kicks, or scratches. We'll just talk just a little bit about this. We do have cats, and they do sometimes, scratch. They don't mean to. They're trying to get away from another animal, or you want to hold them, but they don't want to be held, and they may scratch you. The rabbits sometimes scratch when you're trying to put them away. That's why we wear proper clothing. But if you were to get scratched, the first thing, or bit, the first thing you want to do is make that injury bleed. So if the blood's coming out, well, so is the bacteria as well. So make that, push on that skin and make that injury bleed so that you can flush out any bacteria. The next thing you want to do is head to the sink and use soap and water and clean out that scratch or bite. And then definitely let a teacher know so that we can get a Band-Aid on it and see if we have to fill out any paperwork. So back injuries are also a problem in the veterinary field, lifting heavy objects or animals. So we want to bend with our knees, not with our back. We also want to bring that object closer to the core of our body before we stand up with it. And you don't want to do any twisting when lifting that object, or have it further away from the core of your body. So bring that object close to the core of your body, and you want to bend with your knees, not with your back, and to lift that object up. Floors can get wet. We know working with animals, water gets spilled. It just happens. I spill water all the time. We need to make sure that we mop it up, clean it up with a towel or something, and then also use the wet floor signs that we have in the classroom lab rooms. Also, exposure to x-rays. You must be 18 years old to be around x-rays and while taking x-rays on an animal. So you need to be 18 years old to be able to do that. And you need to understand what that exposure means. Chemical hazards. So in the veterinary field, we work with cleaning agents, we work with drugs, insecticides, like for fleas and stuff like that, the topical stuff we put on animals, and then anesthetic gases to anesthetize animals to do surgery. So you need to be aware of that and know that you need to wash your hands often. You might need to use some PPE like gloves. And then with some of the drugs that we give animals, we don't want to stick ourselves when giving a shot to an animal. And then the anesthetic gases, we want to be able to understand that machine and realize if there's a problem and we're maybe inhaling some anesthetic gases and what symptoms you might have. So you might feel lightheaded, dizzy, might be something if you're working around some anesthetic gases and there's a leak in the machine. So biological hazards, so living tissue and organisms, blood, urine, live vaccines. There's not many live vaccines that we use in the veterinary field. Medical waste, that has been in contact with living tissue, urine-soaked blankets, bandage material, and needles and scalpels. Those are called sharps. And we need to know where our sharps containers are at. So they are the hard plastic sharps containers that you often see in the doctor's office. So we have some of those when we use needles to vaccinate some of our animals from time to time. We will need to put the needles in those sharps containers. So you need to know where they're at and what they look like. For the urine-soaked blanket, bandage material, you just need to make sure that you wash your hands if you're handling any urine-soaked blankets, which you would because it kind of smells. So bandage material, sometimes we find animals have bacteria on their wounds, and so you may be coming in contact with some bacteria if it's on a bandage that an animal might have from a wound. So you would either want to wear gloves or definitely wash your hands. So some zoonotic hazards. We have viruses, bacteria, parasites, and fungi that we all work around in the veterinary field. Some common viruses would be rabies is a virus. And then also sleeping sickness. So encephalitis is a virus. Bacteria, cat scratch fever, so we don't want that to occur. That's why if we do get scratched by a cat, we make sure that we first make it bleed and then wash it out, clean it out with soap and water, and put a bandage on it. Leptospirosis, salmonellosis, brucellosis, anthrax, and tuberculosis are some other bacteria that we come in contact in the animal world. Some parasites, so Sarcoptes mange, also called scabies when it's on humans. So Sarcoptes mange when it's on an animal is scabies when it's on a human. Toxoplasmosis is a parasite that can be found in cat litter. So if you were ever to become pregnant, you would definitely need to let Miss Brown or I know, because potentially toxoplasmosis could be found in litter boxes, and that can cause abortions in females, and we don't want that to happen. So it's highly unlikely, but we don't take the chance. So please let us know if that's an issue for you. There's also visceral larval migraines, which is toxocarisis, and creeping eruption ancylostomiasis. So lots of letters there, and you will learn how to say those terms. So those are some parasites that can affect people as well. So I guess I should have started out by saying zoonotic diseases can be transferred from animals to humans. So that's why we talk about them. So zoonotic diseases can be transferred from animals to humans, and these are a list of some of them. And then we have fungus. So ringworm is a fungus. Even though it says ringworm in the name, it is a fungus. The reason it's called ringworm is because it makes a circular kind of raised little worm looking kind of effect on the skin. So that's why it's called ringworm. It is not a worm. It is a fungus among us. So those are some zoonotic hazards that we need to be aware of. We work very hard to make sure that none of those things you need to be afraid of at the Natural Science Center. And we use precautions on every aspect of the way. So safety signs and equipment. These are things. Oh, my slide is messed up. All right. Well, I will fix that. These are things you need to be aware of. The skull and crossbones means danger or poison. Then you have next to that the radioactive symbol. Behind the radioactive symbol are lead gloves. But radioactive symbol is for radiation when there's radiation in that area or could be used in that area. So we mean x-rays are taken in that area. The biohazard, you'll find those on the sharps container. So that symbol will be on all of the sharps containers. The wet floor sign, we have several yellow wet floor signs, and we use them throughout. The vet lab tends to become a little slippery when it gets wet. That's why we usually have mats down, and we expect you to wipe your feet as you walk into the classroom if it's raining or something like that. So, and we expect you to clean up any water that you spill, especially in the vet lab room. Then you have a dosimeter down here in the lower left. So a dosimeter is a badge that you wear when you are doing radiographs on an animal, and it measures the amount of scatter radiation that you are exposed to. So we're only allowed to be exposed to so much scatter radiation, and the dosimeter tells us how much we have been exposed to. So we need to wear those anytime you would be taking a radiograph on an animal. So again, the lead gloves made their way up here. Not sure how that happened, but I will get that fixed. Then we have a lead apron that you would wear when taking a radiograph to protect all your pieces and parts, vital pieces and parts from radiation. And then back brace. I don't know. There's some people that say those are helpful and others that say they are not. But that is also a part of the safety equipment. So then we have the drug schedule. So there are some drugs that are used for animals that are on this list. The same drugs that are used on humans can be used on animals. So Schedule 1 drugs are defined as having no current acceptable medical use, and they have a high potential for abuse. So those are drugs like heroin, marijuana is up there. I know it does now have some acceptable medical use in some states, but they still have it as a Schedule 1 drug. Ecstasy is up there as a drug that has no acceptable medical use and high potential for abuse. So a Schedule 2 drug is classified as having high potential for abuse and use potentially leading to severe physiological and physical dependency, but it does have some medical use. In this list, one thing that I saw that I didn't quite understand was cocaine was listed there. And I looked it up, and cocaine can be used in some throat sprays for its numbing effect and stuff. So that's one I had to kind of look up. But Ritalin is also in there. Adderall is a Schedule 2. Oxycontin, fentanyl, those Demerol, those types of drugs are in a Schedule 2. And you have to keep track of those drugs. And if they are prescribed to an animal, not many of those are. But as we get down to the Schedule 3, 4, and 5, then you find more drugs that we do use on animals. So Schedule 3 drugs are chemicals that are defined to have a moderate to low potential for physical and psychological dependency. Some of the examples of those. Ketamine is used quite frequently when anesthetizing animals for a surgery, but it is also then used on the black market or whatever as Special K. So in the vet world, we have to be very careful and document how much ketamine we're using, what patient it goes to, because the FDA does come and check those logs that we keep in a veterinary office. So ketamine is one that we use very frequently in the veterinary world, but people can also abuse that type of drug. Schedule 4 drugs, defined as drugs with a low potential for abuse or risk of dependency. Some that we use, Valium can be used for, like, say, a dog that has seizures, something like that. Other drugs on there, Ambien, Xanax, are Schedule 4 drugs. And then we have Schedule 5 drugs. They have a lower potential for abuse than Schedule 4. It depends on the quantity of certain narcotics that are in them. Generally used for antidiarrheal, antitussive, so coughing, analgesic, that's pain purposes. So some of the cough medicines, like your Robitussin, that we do use some cough medicines for dogs to help them if they were to have kennel cough or something like that. So that is your drug schedules. Types of sanitation. So we have cleaning, disinfecting, sterilization, and antiseptics. So cleaning is just physically removing of that debris, whether it's dirt or feces or blood or hair. Disinfecting is destroying most of the microorganisms on a non-living or physical animal by physical or chemical means. Sterilizing is destroying all the microorganisms and viruses on an object using either chemical or heat under pressure. That would be an autoclave, which is kind of like a big pressure cooker. And that's how we sterilize instruments before they go to surgery. Antiseptics are solutions that we use to destroy microorganisms or inhibit their growth on living tissue. So when we scrub an animal for surgery, we are using antiseptics like betadine that has a residual effect. So even after the surgery, betadine is on the animal skin and killing any bacteria that it might come in contact with. It helps to keep that incision clean and healthy. Commonly used chemicals. So we have some alcohols that we use, some aldehydes that we use, like formaldehyde. Second semester, when we dissect our rabbits, they will be stored in formalin, which is a cousin to formaldehyde. Chlorine, bleach. Iodines, I just mentioned betadine and how we use that to prep an animal for surgery. And then we have the ammonias. You never want to mix bleach and ammonia. That can make a bad situation, a toxic cloud if you mix bleach and ammonia. So please make sure you're cognizant of what cleaning solution you're using. And then phenols could be household products like that are found in mouthwash, and some spray cleaners can be toxic to cats. It affects their liver. So we do keep an eye on what cleaning products we have in the classroom. So we only try to use ones that are safe for our animals. But if you ever have any questions, please don't hesitate to ask us. Methods of sanitation, we're almost there. Physical cleaning, using a chemical with a mop or a sponge to clean something. Cold sterilization can be soaking an item like a surgical tool, maybe to do a quick Suture removal might be stored in a disinfectant. Those tools might be stored in a disinfectant, and that's called cold sterilization. You would take them out, rinse them with some sterile saline, and then use them to do a suture removal. Dry heat or incineration, that's with a flame. So in your senior year, when we do microbiology and we're working with bacteria, we use a flame on our inoculation loops. Radiation, there's ultraviolet or gamma rays that can be used for sterilization. Filtration, removing particles from the air using a physical barrier. So those are like in our air conditioning units and our heating units, to catch the particles in the hair, the dust, and the hair that are in the air, and those filters catch that material so we don't breathe it in. Then there's ultrasound. So it's passing high frequency waves through a solution, and it can get into all those crevices. This can be used in surgical instruments. You put your instruments in the solution and turn on the ultrasound, and it sends waves through the solution, and it can get all that debris that's in the little crevices of those surgical instruments. And then we have the autoclave, which is like a giant pressure cooker. It's a sealed chamber where objects are exposed to heat and steam under pressure for a certain amount of time, and that sterilizes the instruments so that they are ready to go into surgery. So that is it for our safety and sanitation lecture. Hope you enjoyed it. And if you missed it in real life, this is your second stop. Or if you wanted to listen to it again, this is one way to refresh your memory or study for a test. All right. See you guys.